Hello, I'm Dr. Gopi Krishna Yedlapati, Senior Consultant Interventional Pulmonologist at Yashoda Hospital's High-Tech City. When the sleep is disturbed, the metabolism of the body is disturbed. Manana, lion laga, tiger laga, gurka pedtaru.
So do you prescribe sleep as a medicine to your patients?
Lot of people after taking the dinner, they go for a walk. We absolutely contradict that.
So we often count on our calorie steps and also the likes on our social media, but how often do we count on the number of sleep hours we get? Yes, sleep isn't just about feeling fresh, but it is deeply linked to our breathing, lungs, and our overall well-being. So welcome to the program, Dr. Gopi Krishna sir, and it's a pleasure to have you.
Thank you.
So before we get into the serious stuff, tell me honestly, do pulmonologists get to sleep like textbook examples, or even you are guilty of late night scrolling?
Yeah, sometimes it happens. So most of the times our work demands, a shift of something like 10 to 12 hours of work. So at the end of 12 hours of work, you reach home, you need to have food, then relax a bit and then go to bed, right? So yeah, sometimes it happens that we tend to sleep after 11 or 11:30.
So even you binge on Netflix and scroll your phone?
Yeah, definitely. So definitely we need to relax or else we don't get into a good night's sleep.
Sleep is so underrated, it's so less talked about. So why do you think that sleep is so important, and what's the connect between sleep and lungs?
I like to talk about underrated sleep, that point. So I see a lot of kids nowadays, especially the teenagers. A lot of people have the tendency that, sleep is waste of time and they need to spend more time with their friends, and they shifted their entire pattern of sleep.
Yeah.
I see a lot of kids walking into the, OPDs with headaches, breathlessness, sore throats, whatnot. Because when the sleep is disturbed, the whole scenario, the metabolism of the body is disturbed. So here, what do we call it as, proper sleep? So anyone who gets 7 to 8 hours of sleep once he becomes an adult? No, absolutely not. The time period is okay. But what about the timing? This is the one which matters the most. So the timing is something like at least 10 o'clock till 5:30. This is the golden hours of sleep. You sleep in those times, the quality of sleep is extraordinarily well, and your performance and the body tends to rejuvenate once you sleep well, and it tries to take the day-to-day, the stress or the insults we try to give to the body, all the things are absorbed very well.
So it's not just quantity, but also the quality matters.
Quality matters a lot.
And most of us, because of the fast-paced life, we get on with 4 to 5 hours of sleep and we think it's okay, I can manage it. But I don't think that's true.
Yeah, exactly. See, body takes to some extent any stress you give, whether it's a physical stress, whether it's a mental stress, or when you deprive your sleep. Here we are using a term called sleep deprived. So most commonly what we are seeing in the latest generation is they are mostly sleep deprived, where they are pushing their sleep back and they are saying that, I have slept 4 to 5 hours or 6 hours of sleep. Still I'm doing good. Still I'm being active. So this doesn't run like that. So in down the lane, when we start, aging, and when we have to work under stress, you don't sleep well, your performance drops by 50%.
But for those who sleep about 4 to 5 hours a day, doctor, and they think, they can catch up on the sleep over the weekends. So do you think that's possible, or it's just a wishful thinking?
Both are there. Yeah, body helps in rejuvenating when you try to give that extra sleep during the weekends. Yes, but does that work out in a long way? Absolutely not.
So let's talk about snoring. We all make fun of people who snore in a way. So when does snoring actually cross that red flag sign, and when do you think that it's a medical thing?
A lot of patients walk in. They say that, my husband is snoring, my wife is snoring. Now the concept of 3 or 4 bedroom flats have come up because, one for the husband, one for the wife, and one for the kids.
Exactly.
So why? Because The snoring, if it is really loud, it disturbs the bed partner. Here, the point is not about the sound. Here, we try to educate the patients and the patient attendants that if the snoring is associated with a pause, if they are not able to, snore continuously and there is a pause, then it's a problem. And why do snoring occurs? This is a common question. A lot of people think it is because of my nose.
Yeah.
I have sinus, I have nose block, so I'm snoring. The snoring doesn't happen at the level of nose. Snoring happens at the level of throat. That is when the tongue and the uvula, kondanalika, chota jeep, so these two are muscles. When they fall back, then when we try to take a breath against the resistance, these two vibrate and produce the snoring.
That's when a pulmonologist steps into.
Yeah, that's the point where if they start choking or they stop breath during snoring, yeah, it's the forte of the pulmonologist.
But don't you think most of us take sleep or snoring for granted and they don't think that they would really need to see a doctor?
Yeah, a lot of people think one who is snoring, manana, lion laga, tiger laga, gurtu ba nidrapotaru. You, as the person who snores, then they will be able to tell you the exact. Because during the snoring, the amount of air entering the lung is reduced. So when the air is reduced, obviously the oxygen is reduced. So because of which the quality of sleep is slowly goes down. When these people start choking or the breath stops during snoring, they wake up.
Golden rule is everybody should sleep about 7 to 8 hours. So do you prescribe sleep as a medicine to your patients?
Yeah, we do prescribe. Specifically, I tell my patients, at least if the quality of sleep is not maintained, it's not about the number of hours, but definitely the quality of sleep, we do undermine telling them that this is very, very important.
So it's called as beauty sleep for some reason, I guess.
Yeah, definitely.
So what are some sleeping hacks or to get a good sleep? What are some practical tips that you would like to share with us today?
In sleep hygiene, the first thing is keep yourself away from the blue light. You're going to bed, then you're going to bed. Unless you are a pulmonologist or a doctor who's going to get nighttime calls, then you will be having your mobile phone, or else your mobile phone is away from the bed. Second, the bedroom should be dark, okay? And there should not be any sounds. Third, lot of people after, taking the dinner, they go for a stroll, for a walk. We absolutely contradict that. Because after you take the dinner, the blood supply has to rush to the GI system, the stomach, and help in digestion, right? So once you start walking, the blood starts flowing towards your muscles and all. This causes a lot of indigestion and lot of constipations in lots of people. And anyone who wants a good quality of sleep without disturbance, any exercise should be done 2 hours prior to your sleep, not after that. And no Coca-Cola, no Red Bull, or no tea or coffee after 7 p.m. Absolutely no. And no spicy food, no binge eating after 7 p.m.
Don't you think most of us, despite of getting about 6 to 8 hours of sleep, we still wake up feeling tired and with less energy? Is it common?
Very common. So, especially in aged people and people who have sleep apnea, where they choke in the sleep, where they don't get the breath or don't get the oxygen into their heart from the lungs, they definitely wake up tired. The other set is sleep deprivation, where they push their sleep back. This is very commonly seen in youngsters as well as in teenagers and people who work little more. Especially we see lots of drivers, we see lots of nurses, we see lots of people who are working in shifts. You got another point here, in shifts. So people who are working abnormal shifts, they are all sleep deprived.
And also, do you think there are some superfoods or some drinks which would help you make sleep better?
Partially I do support and partially not. I don't give my 100% vote to those drinks and all. Yeah, definitely some drinks are associated with nutraceuticals. I hope you understand. They are not proper medications. something like, a lot of people use cinnamon, some people use lavender, and some people use some herbs, which, proven by science too, that they can get good sleep when they use those, pills or drinks or some lotions, sometimes some sprays. So those do help for some people.
So, power nap or a good night's sleep, which team are you?
Power nap. Why I chose power nap is anyone who is working more than 8 to 10 hours during the day, if you give them half an hour of a nap, that particular person is fit as he's woken up just now. So giving that 30 minutes slot to make them sleep, they are going to perform for us like anything.
So, I hope you don't mind when your junior says, let me go and catch up my power nap and come back to you.
Oh, definitely. Definitely. I will welcome that.
So, what are some common myths related to sleep that you would like to bust today?
Sleep related myths, commonly what we see is, like I said, especially for the youngsters, sleep is waste of time. No, absolutely wrong. Unless you sleep well, your body doesn't function well. Your brain doesn't function well. You can't perform in an exam. You can't think well. Okay. The second sleep myth, what I try to tell is, it's about how to maintain yourself when you're drowsy. A lot of people think like, I can be awake if I smoke a cigarette. I can be alert if I take coffee. I can be alert if I take sips of tea. Partially yes, mostly no. It's a myth. Okay. What does the cigarette or a cigarette or tea or a coffee does is, yes, it stimulates your mind, it stimulates your body, but it gives you only 2 to 3 minutes of stimulation, and again your body is back to the dullness and drowsiness. So that's the reason a lot of software companies have beautiful lighting and free coffee everywhere. So they don't want their people who are working in shifts to doze off or feel tired.
And finally, doctor, what is that message you would like to share with the viewers out there as far as sleep or sleep-related disorders is concerned?
Sleep-related disorders, I want everyone, if they are not able to fall asleep quickly, it is taking time, you need a sleep consult. If you're not getting good quality of sleep, means you are tired, you feel, you want to sleep more even though you slept for 7-8 hours, you need a sleep consult. Third, you are tossing around in the bed. You know it is 3 o'clock, 4 o'clock, 1 o'clock. In the night, the ticking of the clock, the sounds around are heard and you are not falling asleep properly. You need a sleep consult. Fourth, if you have hypertension or diabetes or cardiac related problems and you are using more than 2 or 3 drugs to control your blood pressure and diabetes, you definitely need a sleep specialist consult. These are the things I strongly advocate. They should consult a sleep specialist.
So thank you, doctor. It was wonderful interacting with you, and thank you for such an engaging and informative episode.
Thank you.